Welcome to a new episode of the Illusion of Consensus podcast with myself, Rav Arora, independent journalist based in Vancouver. And I'm excited to have Dr. David Schechter, who is a physician based in Culver City, California, and has been practicing family and sports medicine for over 25 years and is particularly focused on mind-body medicine, which is the focus of this podcast. Using mind-body principles and concepts to treat individuals who are presenting with chronic physical pain syndromes. This is something that I've experienced before and worked through a lot in my life over the past couple of years. And this kind of range of symptoms, a range of conditions where people have sometimes excruciating and debilitating physical symptoms, digestive, muscular, headaches, migraine, different kinds of tendinitis, heart palpitations, costochondritis, et cetera, and they spend years and years, sometimes decades, trying to figure out what's going on with them, and are using pharmaceutical interventions, sometimes surgical interventions. I know of one example like that, someone with chronic back pain, and they're not getting any answers and their pain is not going away. Sometimes they may go out for a time, but it returns after some period, and the pain is correlated with all sorts of different interesting things. And oftentimes for these kind of individuals, the solution is psychological, not physical. Put it more specifically, these people, underlying cause of their pain is actually deep-rooted patterns of fear. And that activates the pain cycle and keeps it in motion for years and years. And sometimes people can have pain in different areas of their body, not just in one area. It can manifest in another. And then they go see other specialists and they're not getting exact answers. Sometimes they might even get a diagnosis for some kind of inflammatory condition. And that further exacerbates their fear and kind of misleads them and takes them away from the real solutions for this particular issue. So we're going to talk more specifically about that. I just want to give just a quick overview there. Dr. David Schechter, thank you so much for coming on the podcast. I'm really excited to introduce this to my growing audience. I think a lot of them are very receptive to new ideas and new ways of thinking about our health. And with my own experience and reading Alan Gordon's work and Howard Schubiner's work and seeing other individuals in my own life struggle with this kind of thing, I'm seeing more and more that a lot of people could benefit from this who have not even heard of this and have no conception of what this looks like. So I'm very excited today to broaden people's horizons and help them out and help others that they know who are struggling with, like I said, often debilitating pain, but don't know what to do with it.
Thanks for having me. And my first thought in your excellent introduction, which seems to describe a lot of the patients that I see already in your introduction, is that medicine, Western medicine, is very reductionist. Okay, by reductionist or reductionistic, we mean that science and Western medicine has tended to focus on reducing problems to their lowest common denominator of a molecule or a chemical or that kind of thing. And for some types of conditions, Western medicine is clearly more effective than any other kind of healthcare approach that you've ever had, including trauma, including cardiac arrest. There's never been treatments for some of these things that we have currently. However, human beings are more complicated than that. And it turns out that our brain and our mind and our emotions play a significant role in health that kind of conventional Western medicine has tended to ignore. And so what I've done and what some of my colleagues have done and what my mentor taught me, Dr. John Sarno, was how to bring that back into the diagnosis and treatment of my patients.
So how did you get involved in this? So your mentor was Dr. John Sarno. Was that the starting point? And did you yourself also struggle with mind-body issues or had others that you knew that struggled with it? Was that part of it or not?
No, I was a medical student at NYU. I was my recreation and my release was basketball and running. And then my knee started to hurt. And that becomes a big problem when you want to run and play basketball to release the stress of medical school. And so I went to the student health, didn't get any relief. They even referred me to a highly qualified orthopedist. Didn't get a clear diagnosis or relief. Got frustrated, more worried about it. I went to the library, tried to research things as a medical student. And then I walked into the office of Dr. Sarno, who had lectured to us in anatomy. And I did not know at that point he was beginning to develop these concepts of mind-body medicine. But I walked in just thinking he could prescribe some physical therapy for me, maybe some high-tech treatments. And I walked in there and he said, just explain to me what's going on briefly. And I told him, and he said, I don't know how you'll take this, but 95% of this chronic pain is actually psychosomatic. And I was shocked. I was very surprised. It was like getting hit with a blast of cold air. But that moment in time has defined a significant portion of the next 30 years of my career.
And if you don't mind, what kind of knee pain was it? Was it like inside medial pain or outside or
tendonitis, like a patella, like a tendonitis, patella tendonitis.
Yeah, that's so funny. I've actually struggled with that for a while.
Yeah, look, sometimes it's mechanical, but I wasn't getting better, and I had strengthened my legs up like I was supposed to. I had done the things I was supposed to do, and I wasn't getting better. And I also it was very stressful being a medical student. I was not enjoying my first year of med school. For anyone who knows about medical education, it starts off with a lot of book study and labs and things. And then it moves on eventually to the clinical years. And those clinical years are what I really enjoyed. But memorizing biochemistry and anatomy things wasn't my favorite part of the curriculum. And plus, I had made an adjustment from being at a college that was kind of in a small town in a very pretty area to being in Manhattan, an exciting place to be, but nonetheless, a little bit more confining. I had a little tiny apartment. Actually, I shared an apartment with somebody, and it was microscopic, my section of it. So, it wasn't a great year for me, right? And, I didn't know that had anything to do with it until Dr. Sarno. So he said to me, I have these lectures I give patients. He said, I see you're a little skeptical. Come to one of the lectures. I'm giving one on Monday night for my patients. So I go to the next Monday night seminar, right? And there's a bunch of well-dressed people from the Upper East Side, Upper West Side of Manhattan, typically in their 30s, 40s, and 50s. I was 21. And I'm listening to the lecture, and he lays out this concept very effectively, and it made perfect sense to me. And I came up to him afterwards. I said, I think I've got this thing. And he said, well, call up my office, make an appointment. I'll see you for a consultation, as a complimentary consultation as a medical student. But I went home that night and sat down on my bed, and I felt like a weight was lifting off of me, right? That weight of fear, that weight of permanence, which people worry about, that weight of nobody knowing what's wrong with me. It made sense to me that combination of personality and stress and psychology, were significant factors here in the pain. And I did see him subsequently to get examined. He confirmed this diagnosis, which we use the acronym TMS. I can talk about that more later. And then I started to feel better. I started to walk a little faster. Then I started a little light jogging, shooting some free throws. And next thing you know, in a few weeks, I'm back to playing basketball. It was like a miraculous recovery to me, with no pills, no shots, no surgery. And I shared it with medical students and some of the physicians that I knew at the school, and they didn't take it seriously. They didn't really understand it. They didn't really have an open mind for it. So that was the beginning of my exposure to the fact that the medical community and many lay people will not always be open to this. And I'm glad to get into that a little bit more. But that's how my journey started. The following summer, I got a research grant.
Yeah, I do want to pause there. How long were you struggling with this knee issue? Was it months or years?
It was more in the months.
Months,
but it was enough to become like kind of a chronic thing. It was in the months.
Gotcha.
Chronic is defined as more than 3 or more than 6 months, depending on who you ask or how you qualify. But I was certainly moving in that direction.
Gotcha. And treatment, I know I've heard in this area, and we're going to talk about the treatment for some people, and for one of my particular issues relating to, we can talk about after, but for one of my issues, for example, just knowing the fact, someone informed that this is mind body, basically fixed the problem over a couple of weeks. In other cases, you really having to go inside and to really, the somatic tracking, which I'm sure we'll talk about, really looking at those fear patterns that are generating that pain and creating a sense of safety, which 100% we're going to talk about. But for you, was it more of an instant thing, or was it more of a treatment?
Yeah, we can definitely dig into the treatment program and how it's evolved over the previous 3 decades plus since I was diagnosed. But for me, it was the diagnosis from Dr. Sarno. It was the explanation. He used to say education is the penicillin for this condition. In my case, it was. My psychology, fortunately, wasn't that complicated. I was just not a happy person at that point, right? Due to external circumstances. So it turned out I didn't have to dig really deep. Some people do. It was for me just like knowing what was wrong and being advised to go back to activity and getting rid of the fear.
Yep. Gotcha. So you started telling your colleagues, you were saying, and you realized that this is not widespread knowledge. Obviously, it still isn't today. Yeah. So to talk to me now about getting into a clinical practice and implementing, like, did you have to gain more education in mind body? I'm assuming so. You had to learn more, understand what's going on, what the symptomology and the causes are.
Yeah, I got a research grant, so I was able to spend a whole summer in Dr. Sarno's office, literally in the room next to where he saw patients, and then he would call me in to see all the patients with him. So I learned a tremendous amount from that. I participated in the seminars that summer, and the most important thing I did is I telephoned 177 of his former patients to do a follow-up study, and began to hear those same kinds of responses that I had. So I knew this wasn't just me responding to something. I knew it wasn't just a placebo. We can talk about what that means later. And it was really more of something that was extremely effective when utilized for the right patient, the right time. So that's how it began. And then I completed my residency in family medicine and sports medicine certification, and came out to the West Coast, stayed in touch with Dr. Sarno. And he had subsequently written his first book. I actually helped him edit his first book called Mind Over Back Pain. It's not as well known, but I'm honored to have been mentioned in the acknowledgments of that book. And then his second book, Healing Back Pain, became a bestseller. And so suddenly he had a lot of patients from all over the country reaching out to him. And he could only see so many. And he mainly wanted to concentrate on New York and New Jersey. And so out in California, he said, could you see some patients, right? And I said, sure, I'd be happy to see the patients. I'm interested in this work, but, you can't get too many people who are open to it. And these people were open to it because they had read either his first or his second book. So I started to develop my own program on the West Coast with a higher and higher volume of patients, so I could work out the kinks of lectures and seminars. And eventually I developed an audio program and a workbook and books and all of that. So that's how I started really working off of the referrals from Dr. Sarno, and eventually developed my own reputation in the field.
Interesting. And yeah, let's delve into this area. So what is mind-body pain or chronic psychosomatic pain? And briefly, like which term do you like more or find more useful? I know psychogenic or the mind-body syndrome, TMS.
Well, the acronym TMS, which originally was tension myositis syndrome and then became tension myoneural syndrome. That's an acronym I'm very comfortable with. We don't even have to dig deep into what the words mean. We can do that if you want. It's also called the mind-body syndrome, psychophysiologic disorder. But the acronym TMS is nice and easy to remember. And it's, we are talking about how the mind influences the body and affects the body, et cetera. So, you diagnose a patient, right? They come in with symptoms, and you're trying to determine, is this due to a structural or biochemical problem, or is it due to a mind-body disorder? And here's the interesting thing for your listeners. Almost any physical symptom can be one or the other. So let me give you a couple of examples. You can get a headache because you get bopped in the head, or you can get a headache because you're stressed. You can get diarrhea because you ate some bad food or traveled or got a parasite or whatever. You can also get a diarrhea because you're nervous about an exam the next day or a date that you're going to have. You can get chest pain from a heart attack or from angina, especially if you're an older person. And on the other hand, you get that same chest pain from anxiety, or as you mentioned, costochondritis, which is kind of a TMS equivalent for that. So physical symptoms can be caused by a structural or biochemical or disease process, or they can be caused by the mind, right? This is what people have to learn to accept, and which I teach them. And once you go from that, then what you're trying to do with every patient is to determine what's the best path forward. If you sprained your ankle 2 weeks ago, probably physical therapy is the best path forward. If you've sprained your ankle 6 months ago and it's not getting better, assuming the MRI is normal, you might want to be talking about stress. If you have back pain because you lifted a refrigerator yesterday, you might want to put ice on and take some ibuprofen. If you have back pain that doesn't get better and your x-rays and MRIs really don't have a clear cut cause for that, then you might want to start thinking about whether it's more about your job or your relationship or your life circumstances that are contributing to causing your back pain. So everybody I individually assess, and there's a lot of people out there who can benefit from understanding that their mind can cause the symptoms, just like their different illnesses that we mentioned can cause it.
Yeah. So let me play like just slight devil's advocate or just sort of challenge a little bit. So you said first, if someone has pain or any kind of condition, you said two possibilities: psychosomatic or biochemical or structural. Broadly speaking.
Yeah, I mean, structural and biochemical could be a little different because biochemical could be inflammatory, and structural could be more of a mechanics of the body kind of thing.
Right. Okay. So like roughly three possibilities. Now, are there other possibilities too?
There are other possibilities within those possibilities. So as a doctor, you learn, 30 different inflammatory conditions that could cause certain symptoms or diseases. If you're talking about, gastrointestinal, it's different than the back in terms of what could be causing a pain, whether it be a growth or whether it be an ulcer. So there's a lot of different things within those categories, but I'm just giving you broad categories saying that and there was a doctor who once described this to me. He sort of made it like a triangle. He said that, one triangle is kind of biomechanical and structural. One triangle is kind of more chemical and inflammatory. And one triangle is psychological and psychosomatic. And that pretty much encompasses human health. So those are broad categories.
Right. Now, the not necessarily pushback, but just kind of a critical question I've thought about. It's actually a point a friend has raised to me before, is that, on some level, some conditions may never be 100% psychosomatic or 100% biochemical. And so how do you decide that? Could there be conditions where, I guess, how do I say it? It would be very helpful to tell the person this is psychosomatic and they would experience a lot of relief. But in reality, there could be some biochemical factors as well. Yeah.
That's a very good question. And, that issue is brought up in my book, Think Away Your Pain, because prior to that, Dr. Sarno's work was very black and white. It was either one or the other, right? As you're kind of talking about, or the triangle, like it's one or the other. And I do bring up the issue of a mixed picture. So a person could have, something going on in the back that might be contributing, but then you're adding a lot of psychological or emotional elements to that to amplify it. And I have ways of working with the mixed picture patient. So yes, I do believe that there can be a combination, that there's a gray area. It's not always the black and white. Black and white is great when it exists, when I can look at somebody and say, there's nothing on your MRI, there's nothing wrong with your back. I typically get a great response to that. But again, I want to be honest. I want to be objective with my patients. I don't want to be, this is not a cult. This is not a religious faith issue. This is really trying to bring a kind of a modern science to your problem. So I do believe in the gray area. I do believe in the mixed picture, and I discuss it and Think Away Your Pain.
Right. And when it comes to that topic, some people have a fear, and in my experience, that fear, which I've had before, and others around me I know have had, at least in my experience, this particular feeling is often a symptom that this is highly psychological, not anything else. But there sometimes can be a feeling by some people is that their anxiety, particularly individuals suffering with, say, costochondritis or chest pains, that's kind of one sub area of this. There can be a fear of like, maybe my psychological issues will actually end up causing real physical issues. Maybe I'll have a heart attack, right? And, maybe over time through chronic stress, I can give myself some kind of cancer or something like that. What do you have to say for those people?
You're talking about years or decades. If you're someone who realizes that you're stressing yourself out too much, or you're responding to circumstances in such a way as to make yourself more anxious than is healthy, a little bit of anxiety can be good sometimes. But then yes, that would speak to maybe an issue of needing to institute a health program or a lifestyle program that would reduce your stress levels or manage your stress better so that you don't develop conditions 10, 20, 30, 50 years later. But we're talking here about somebody who has a particular condition or symptom at this particular time. Mm-hmm. And, I know that I can often help them unravel it by working through the psychological and the educational parts of this problem. But I don't think, like, in the short term, if you're 30 years old and you're anxious, you're not going to have a heart attack from that. I mean, could chronic stress contribute to heart conditions? Absolutely. Absolutely. There were papers written called Type A Personality in Your Heart. They were written decades ago. And here's an interesting one. So there was this cardiologist who noticed that the fronts of his chairs in the waiting room were worn out a lot more than the backs of his chairs. So what that meant is that people were coming in, they weren't sitting and relaxing. They were like sitting on the edge of their seats, literally waiting for that appointment. And he called that the Type A personality as a result of realizing that a lot of his patients were the Type A were angry, irritable, overreactive. He had certain elements to that personality. And he wrote papers on that. And it's pretty well established in cardiovascular medicine that being a Type A can contribute to heart disease over many years. We call the personality for chronic pain Type T. And it's more related to being hard on yourself, being a perfectionist, a people pleaser, and that sort of thing. So it's a little different criteria. It's not exactly Type A. We call it Type T.
And what is Type A?
Well, Type A is the personality that increases your risk of heart disease,
right,
and vascular disease. It's that
kind of
hard driving, angry, irritable executive or whatever. Type B would be that really mellow surfer or skier that maybe just takes life a lot less seriously. Now, to some degree, we're born with our personality, right? We can't just kind of take on someone else's personality. But as we grow up, we can learn from what we're born with, and we can work with it, right? We can learn to meditate if we're more Type A. We can learn to exercise regularly if we're more Type A, to kind of tone things down. If we're Type B, we may have to discipline ourselves to get through school so we can get a career going or something like that, because we might be more inclined to just chill out a lot. And that's great if you've got an independent source of income, but otherwise it may not work so well. But for the chronic pain patient, it's a different set of personality characteristics that is part of my assessment on whether you might have the condition we call TMS. Right.
And to close the loop on this, so people... Yeah, you could say people sort of higher on the anxiety spectrum, people very anxious, very irritable, more likely to have kind of quick sympathetic activation. They can struggle with a whole host of issues. And that, is often, their issues. I've heard people like that, very quick to talk about how their symptoms, might be contributing to a physical disease, and they're worried that maybe I'll go into cardiac arrest with all this tension and stress I've had for the last 5 years. Like, I'm scared to go to the doctor. Something might show up. Right.
Well, that whole thing about being scared to go to the doctor. I mean, obviously the logical answer to that is, well, maybe you need to go to the doctor because that's the person who needs to get his blood pressure checked or her lab work checked or that type of thing. So, as I said, I do primary care as well as the chronic pain work. And I have some people haven't been to a doctor in 20 years. Some of them say they're too healthy and some of them say they're too worried. So there's different reasons. But there are a lot of great integrative approaches to health that can help you with excessive sympathetic nervous system. So the sympathetic nervous system, just to clarify, is the fight and flight response, right? Fight or flee or freeze. And the parasympathetic nervous system is the one that relaxes you and calms you. So when you get that nice, let that exhale and you kind of feel a little bit calmer, that's the parasympathetic nervous system. People should have a good balance between the two, right? If you're too parasympathetic, you might fall asleep all the time when you're on a podcast. And if you're too sympathetic nervous system, by the way, not empathetic, I'm not talking about good sympathy here. I'm talking about sympathetic nervous. If you're too sympathetic nervous system, your heart's racing, you're nervous, you're jumping all over the place, and you're a little bit too excitable. So there's a middle ground. We're trying to find that middle ground for people, and your middle ground might be different than someone else's middle ground.
Yeah.
But yeah, that's what we're looking for.
Yeah. I'm just reminded of something. It's not really off topic, but it just came to my head. I heard this fact the other day. I think his name is Rick Hansen. He's a psychologist. He was on Sam Harris's podcast. I believe that's the name. And he said something, he deals with people. Yeah, Rick Hansen, psychologist. And, he deals with kind of CBT approaches. That's kind of one dimension he works in. People with acute symptoms of anxiety, stress, fight or flight. And one thing he said was, as a fact, and I was almost skeptical. I was skeptical and am skeptical in a way about it. But he said, no one has ever died of a panic attack in history, ever. Does that jive with mind?
Yeah,
body?
look, a panic attack is one of the most frightening things that you can experience. You feel like you're dying. You feel like you don't even know you're in the world. It's a crazy thing. If anyone's had it, it's really frightening. But people don't die of it. It feels like you're going to, but you don't. In fact, one of the ways we can tell people to handle panic attacks is there's many approaches, but one is to just lie down on the floor until it's gone, and you'll be fine. Another approach is to run in place until it's gone, because it kind of helps it to go away if you burn off some of the adrenaline. But the point is, it has a time. It's a time limited event. So look, anxiety and depression, these are very important emotions. But in the short term, they're not going to kill you. With the exception of somebody who becomes suicidal, and in that case, you need to see a doctor right away. And obviously, there's hotlines and other things to help you with if you're thinking of hurting yourself.
Yeah,
call those hotlines and get the help. But with the exception of that, these conditions don't kill you. They can make you miserable.
Yeah,
but they don't kill you. But
interesting.
Yeah, you have to be.
Yeah, I was just thinking, like, so it's not, and I can think of so many possibilities, but it's not possible for someone to be so hyper anxious, so nervously, aroused, sympathetic activation that can put them into cardiac arrest or some kind of cardiac condition.
Well, that's you're asking questions that aren't, in a sense, part of the core message I want to teach the audience, because they can be a little bit frightening beyond what people want to hear, and it might be people will turn off the podcast before hearing the rest of the message. But let me just say that at its extreme, stress can make you sick. That's true. And there's some very, very rare cases of what's called the broken heart syndrome. It's called Takotsubo's cardiomyopathy. It happens actually more to women than to men. These are very rare conditions, and I think what we want to focus on is the more common conditions, because common things happen commonly, right? There's an old saying in medical school that when you hear hoof steps, when you hear hooves, or you hear an animal, think about a horse, not a zebra, because horses are common and zebras are rare, and you have to go to Africa to see them, or a zoo. So let's go back to the common stuff, and then we can, these rare stuff we can talk about if you want.
Yeah, but I'm glad you're acknowledging that, though, because for some people it can be very black and white, and kind of broad general statements can sometimes obscure some of the complexity. And I do think, though, generally, people who are thinking along those lines, like I've presented here, and believe me, that this was kind of the dominant sentiment that I was dealing with a couple years back. It's like doing all this research that can often be a symptom, right? When people are out there looking desperately online and looking at these rare conditions, things, and that's part of the problem, right? You go on Google and you search up anything. I have chest pain, I have stomach pain, I have bladder pain. Oh my God, what the hell? What's going on here? Like,
I deal with this every day in the office. That people do research that ends up unfortunately making them worse, not better. There are some situations where it can be helpful to read upon the internet. And again, I've been a doctor long enough that I was there before the internet, when the internet was small, and now when the internet's huge. And I also am dealing with patients that spend too much time, almost become obsessed by researching on the internet. That can be one of the treatments that I give people with chronic pain, is you've got to promise me you're going to stay off the internet now. Just read these books. You know how Apple talks about its ecosystem, right? They want you to go on their apps and this and that. That could be another show that you probably would do with somebody else. But I have an ecosystem of TMS work that I encourage people to stay in. I have certain books and certain workbooks and certain podcasts and certain movies that I want them to focus on, because when they go outside of this, it dramatically increases fear and worry.
Right. And again, that's part of the problem. And I want to get into kind of specific symptoms or signs, but that I think is such an important piece, is when you are in a state of entertaining these very rare possibilities, right? And this can be beyond mind body too, right? It can be, people with these kind of issues, and I can speak for myself, I can speak for many other people. The often fears can be of many other things, of being very quick to worry about things,
Sure.
Like, oh my God, my wife didn't come home and it's been 2 hours. Oh my God, what if she died? Well, what if this happened? What if I'm afraid to let my daughter go play outside because what if she gets abducted and abused? So
you're talking about anxiety, and you're talking about catastrophizing. So catastrophizing is one of the things that we see in people with chronic pain and mind-body disorders and TMS, where they go from it could be, I've just got a stomach ache, to, oh my God, I've got stomach cancer, right? So they go to the catastrophizing side. The other thing that your audience might want to hear from me, I think it's an important point, is that our tests nowadays are too good. If you get an MRI of a certain part of your body, you're far less likely to miss something. Your doctor is far less likely to miss something than to find things that are irrelevant. So in some ways, our imaging is too good, because it doesn't show just things that are relevant to your problem. It shows things that are peripheral or unrelated or coincidental. And that's an important thing to understand. If they do the right tests, they're not missing a cancer, right? I mean, there's too many good opportunities. That's not to say that in some cases it's difficult to diagnose cancer in the very early stages. But in general, if you have a symptom that's been persisting for a while and you've had the right tests, the right scans, it's not your chances of missing something are very, very, very low. It's really more likely that you've been overdiagnosed than you've been underdiagnosed, in my experience doing this for many years.
Hi, everyone. A quick word from our first and exciting sponsor, Alchemy Elements. Alchemy Elements is a powerful adaptogenic supplement. For those of you who don't know, adaptogens are a class of plant compounds, primarily herbs and mushrooms, which can help build the mind and body's resistance to stress. Alchemy Elements contains a very unique and carefully selected blend of 9 adaptogens, such as lion's mane, cordyceps, polygalaroot, and shilajit, and they can help boost energy, boost your immunity, and increase focus, and overall stabilize your mood. It can have a wide array of effects, which can often depend from individual to individual, but it's a great way to start your morning and generally increase your focus and your energy levels. You can just pour 1 scoop of Alchemy Elements into your morning coffee or your protein shake or smoothie, and you're off to the races. It's a great way to start the day. I use it every day. I find that it can generally stabilize my mood levels and increase focus, especially if I want to get a big project done or finish a very important task. Alchemy Elements often is a great way to kind of start and get my focus going and get me primed for whatever task I want to accomplish. We're very excited and very happy to work with Alchemy Elements. We've been working with them for a couple of months, and now in this new iteration of the podcast, we're going to continue our relationship, which is very special to us because Alchemy aligns with our mission and values of individuals taking greater ownership of their personal, mental, and physical health, and relying less and less on corrupt and flawed, generalized kind of medical advice, and less reliance on pharmaceutical drugs, and more of general interest and focus on holistic health. For a limited time, Illusion of Consensus readers and listeners can get 10% off their first order using the code word illusion, or 30% off a subscription monthly order, where you can get a monthly shipment of Alchemy Elements delivered to you. For the subscription orders, you can also get with it a bonus gold kit to store your Alchemy Elements. Overall, I think Alchemy is a fantastic product. I highly recommend you check them out in the link below in this podcast, wherever you're listening, Spotify, Apple, Substack, Rumble, or YouTube. Just go to the link, use the code word illusion, and you can get your discount and you won't regret it. All right, back to the show.
So let's talk about this in a very direct way. I think this is a good question. So people listening right now, some number of them might be curious or wondering, like, oh, maybe I have a psychosomatic condition. Maybe I've been running in circles trying to figure out what's going on, and this pain won't go away. This anxiety around the pain won't go away, or a particular, might not be a pain, but it could be a particular symptom, like we talked about GI stuff, bladder related, or et cetera, et cetera. What are some key signs that your condition is psychosomatic rather than physical?
Oh, that's a very good question. You know, I developed a simple questionnaire that's on my website, mindbodymedicine.com, that people can fill out.
I'm gonna link to that in the description.
If you've got 6 or 7 more points out of 10, you're very likely to have a psychophysiologic condition or psychosomatic condition. So I talk about things like, if you're worrying about your condition a lot, that increases the chance that it's psychosomatic. And nobody wants to be sick, but when you have a cold, you don't really spend that much time worrying about it. If you sprain your ankle, you're annoyed, and you're afraid you may not be able to play for a while. But again, you don't spend the whole day thinking about it. So if you're spending a lot of time thinking about something, almost like obsessing about it, worrying about the cause, it could very well be this TMS condition we talk about. Another thing is the personality characteristics. I mentioned if you're extremely hard on yourself, a perfectionist, a people pleaser, highly responsible for others, you're more likely to have one of these conditions. Okay. If you had a challenging childhood, or you had, hopefully not, but abuse as a child, or there's big T traumas, there's little T traumas, you're at increased risk for these conditions. If you had that, you don't have to have had those things to have these conditions, but you're at increased risk. Similarly, if you've tried a number of different treatments recommended by respectable...
I want to just pause you for a second before we go to that. When it comes to the psychological, you're describing a profile of people. If you've worried a lot, if you're obsessing over the pain, overthinking, perfectionism, people pleasing, that makes sense. What about something I've thought about before? Would you say there's any kind of overlap or indicators with respect to psychological diagnostics, like people with OCD, people ADHD having a hard time focusing, being present, or people with generalized anxiety, obviously, or depression? Are there any relevant diagnostics there that could increase the chance?
Well, I mainly focus on the personality characteristics, because I've seen people with this condition who have no depression, and I've seen people with this condition who have mild depression, and I've seen people with this condition who have no anxiety. I've seen people with this condition who have severe anxiety. So I don't think it's really about having a particular psychological or psychiatric diagnosis. It's really more about having symptoms that don't get better, treatments that aren't working for you, tests that don't have a clear cause, certain personality characteristics and types that I've been discussing and mentioning. And those things lead me down the path. The other thing is, you may have had prior TMS or prior psychosomatic conditions. So, for example, I have some patients come in their 40s with back pain. And when I talk to them, it turns out they had migraine headaches in their 20s, and they had irritable bowel syndrome in their 30s. Well, those are both in this functional syndrome category. And so that increases your risk of having this, right? If you had chronic abdominal pain as a kid that nobody could figure out the cause of, or you had some of these other conditions that I started to mention, like IBS and headaches and back pain without explanation, et cetera, you're at increased risk for these things. So that's really what I'm looking at, more than a specific psychiatric.
Yeah, sure. Yeah, so let's talk a little bit more about that. So, you talk treatments. So let's start before. So again, people listening, we've laid out the psychological indicators. Usually, in my experience, that doesn't go a long way in convincing people, because it's like, oh yeah, well, sure, I could be anxious and still have cancer in my stomach or whatever it is. So when it comes to physically, let's talk about indicators in terms of what they're feeling, their pain, duration, moving. Can you describe that? What indicators they might have physically?
Yeah. Look, if you have abdominal pain that's been going on for a long time, you should have the appropriate test for that, right? I mean, there's things like colonoscopies, there's scans. I mean, we do all that medical stuff, and you should have that medical stuff. But you mentioned. Sorry, I lost my train there for a second. You mentioned
So
abdominal
duration
yeah.
of pain, how long the pain lasts, when it comes.
Yeah.
Let's
Right.
talk
So,
about the indicators.
yeah, symptoms that come and go are more likely to be mind body than symptoms that are constant. Although we have people with constant symptoms who are mind body, right?
Oh, really?
Symptoms that get
Is that's true? Symptoms that are more likely to come and go, or could
yeah,
be.
there's a little bit higher incidence of in the TMS, chronic pain, psychosomatic, that it may come and go. You may have a very good period and then a little bit of a worse period, or back and forth. Another thing would be if you're better or worse on vacation, that would be an indicator that this could be the problem, right? Because if you're better on vacation, maybe you don't like your work, and you're more likely relaxed on vacation. On the other hand, some people need the structure of everyday life, and they get worse on vacation because they don't have that structure of getting up and going to the office or doing work or whatever. So any change if it's a physical problem, vacation shouldn't make any difference, right? If it's a mind-body condition, it could make a difference. So these are the kind of things we look for, these subtle patterns and connections where there's inconsistencies. It doesn't make sense. If I say to somebody with a back problem, how do you feel when you exercise? Oh, I feel great when I go to the gym. Well, that sounds like it's probably not structural. That's probably mind-body, right? Because going to the gym it would be physically stressful. But if you like that workout and you like that exercise and burning tension off, it could improve a mind-body condition. So there's some interesting inconsistencies in people's patterns that we can detect with a mind-body condition, and then that helps them to believe and accept it. Because here's a key thing. If you don't get to the point, you don't have to be here right now, but if you don't get to the point of accepting the diagnosis, you can't really use this work to get better.
Yeah.
So that's right. If you had diabetes and you just took the diabetes pills, your sugar would improve. It doesn't matter if you believe it or not. You're just doing it. But with the mind-body stuff, you have to actually get to the point of accepting, yes, this is what I've got. And because that is part of that's part of the treatment. That's part of the cure, is to believe this and to stop obviously worrying about something else. Now, you had mentioned earlier, how do I know I don't have stomach cancer? How do I know I don't have a brain tumor? Well, if you have these certain symptoms, you get a scan of whatever it is you need to get. But you don't keep going to. I have patients who've seen 15, 20, 30 doctors by the time they come to me. That's a little bit overkill, right? Getting the right tests makes sense, but continually looking for the conventional and alternative and all of that, and never getting to where you're getting better, you might want to look at this approach instead.
Now, going back to what I was saying earlier, so for some people, the pain can come and go. But for other people, the pain can be constant as well, right?
Yeah, can be, sure.
Pain can just stay there. Or the pain in my knee, the pain in my back, it's just always there.
Yeah, it can be constant, but we sometimes see in those people with constant pain that there is a worsening either during or after stressful incident, or if they get upset on the phone, they get upset with a family member, they notice that they're worse. So that's how we begin to get them to get that awareness that it's not just about the back or the knee or the stomach, that it's about how I feel. It's about my emotions. It's about my perception of the world. And that's how we help them with that.
I guess I've done a lot of research in this area. There's more I think we can talk about too when it comes to physical indicators. I guess one thing that is viewed to be as true is if you have different areas of pain that aren't explained. You have this weird stomach condition that doesn't make sense. You also have pain in your back, and you also have migraines. That can also be a sign when you have multiple conditions.
Yeah, you might have them all at one time, or as I mentioned, you might have had one in your 20s and one in your 30s and one in your 40s or your teens or whatever. So multiple conditions or multiple parts of the body affected, or different conditions at different points in your life could definitely increase the likelihood that this is a mind-body condition rather than a structural condition. But you could just have one area of your body involved, and that still could be a mind-body condition.
Yeah. And this is very important. Let's lay out also, I don't know if we can, let's just lay out roughly the range of what problems we're talking about, right? So headaches, tendinitis, muscular issues, digestive issues, bladder, what else?
Boy, it's a long list. I'll tell you, it's a long list running from the top of the head to the bottom. So the head would be headaches, either tension or migraine. I've seen people with neck pain that isn't explained, and it turns out to be this.
Can we actually just take a pause? So headaches, for example. That's. I know some people. I've looked into this. I haven't experienced this myself, but for headaches, could there be other common causes too, other than mind body? Are there other common issues?
Well, there's some people who have either a genetic or an inherited risk for migraines or cluster headaches.
Okay.
And these are just, physical processes that go on with the circulatory system, the vascular. Sometimes it's triggered by food. Sometimes it's triggered by smells. So these are physical processes. The question is what's triggering it and what's making it keep going. When you talk about tension headaches, it could be your posture's poor. You're spending too much time at the computer, or you sit with your neck too far forward. Mm-hmm. And so there are physical reasons why you might have headaches or neck pain, but hopefully those things get corrected. You get some physical therapy or chiropractic, or you start sitting up better, or you get a better computer monitor, and these things go away.
Yeah.
Right?
And nutritional, I've heard some people. I've heard some research on deficiencies in magnesium, electrolyte imbalances, other potential nutrients or vitamins could cause headaches.
Yeah, I don't find that to be a common cause of headaches, but but certainly getting routine blood testing is important. High blood pressure could cause headaches. You may not know that if you haven't had your blood pressure checked. So There are definitely physical causes of headaches that are not particularly related to the emotions, and yet there are a lot of emotional impacts on headaches, especially when they're more chronic, especially when medications aren't helping or you're becoming too dependent on medications. I mean, I've had migraine headache patients who were on the most powerful modern medications and controlling it to some degree. But when we work through this model, we'll discuss the treatment, I think, in a few minutes, but we work through this model of treatment, they got their headaches went away and they got off all the medication.
Yep.
So it's pretty amazing. One of them was actually a physician, and her husband was a doctor too. And her husband couldn't even believe it, even though he was a physician, right? And she got completely off of her medications and it got better.
Yeah. So if just lingering on this kind of arbitrary example, but if someone doesn't have high blood pressure, doesn't have some of the other things you laid out, that other structural causes, posture related, that could cause headaches, then it could be mind body. It could be psychosomatic.
It could be mind body. Look, the worst thing everybody worries about with headaches is a brain tumor.
Yeah.
And so there's a 25-minute solution to that, which is to get a CAT scan or get an MRI, and that'll rule it out 100%. And then you don't have to think about it anymore. So if I have a patient with chronic headaches, and again, most of these people have already had the scans, but if I've had somebody who has headaches, and let's say you're 26 and you never had a headache and you're suddenly getting terrible headaches for 3 weeks, well, you need a scan. Could just be stress, but you need a scan. If you're 45 and you've been having headaches for 25 years and it's always been the same pattern, you probably don't need a scan. But if the pattern changes, maybe you need a scan. So look, there are simple medical tests that we can do that just take the structural off the table, and then we can kind of dig into the mind body.
Yeah. Okay, let's continue on our journey from the head to the...
Yeah. So we talked about, you could have pain in your neck. You could have pain in the back of your neck. It could be mind body. You could have chest pain. Now, again, chest pain is complicated.
One thing, jaw pain. Jaw.
Yeah, TMJ, jaw pain, absolutely. I have people with teeth pain. This has become... I've had a run of these in the last couple of years where people have unexplained teeth pain.
Wow.
And it turns out to be mind, body, or stress. But jaw pain is a common one. The TMJ and all of that. And that's where we put a lot of stress. We grind at night, et cetera. That can cause jaw pain and headaches.
Yeah. Okay. Yeah. Before we go down, another thing I remembered, people, I think I've heard from a couple individuals, pain that can flow from area to area at a time. And I think the one I'm thinking about, someone said once, jaw to neck to chest pain, all this excruciating chain of pain that can come at a single time. It could kind of move.
Well, if I somebody with chest and jaw and neck pain, I would also worry about it being a cardiac event, because chest. But again, you have to, as a doctor, you have to take a history, examine the patient, understand the patient's situation, and you can usually quickly exclude a cardiac problem, and then see what else it might be.
Right. But that can be psychosomatic if they don't have any cardiac issues, but they're having moving jaw, head, Yeah,
that could be psychosomatic. Yes,
and that's, from what I've heard, that can be common, right? Multiple areas of pain that can move from the shoulder down to the elbow, like that's common. Am I right?
It's common. Now, I think for your listeners, the term psychosomatic is important. We're not saying this is imaginary. We're not saying you're making it up. Psycho means psychological. Soma means body. So really, psychosomatic is the Greek version of mind-body. We're just speaking Greek here. So that's it's not pejorative in any way. It's not putting you down. It's just saying you're a human being and you're dealing with the stresses we're all dealing with to survive on the planet, and that's why your physical symptoms are occurring. That's all we're saying. Psychosomatic. But yes, those are symptoms you can have. You can have chest pain. You can have abdominal pain. You can have pelvic pain. You can have.
I'm going to pause you again because more and more. This is so interesting. I'll relay. No, I won't give the full story, but I'll relay one particular experience. I had very chronic right eye pain in 2020 that I had no idea what was going on. I went to the eye doctor multiple times, and I got some kind of diagnosis, something related to allergies or screen time, and I was given drops. Kind of worked, kind of didn't. Got stronger drops. Went again, got even stronger drops. But pain so bad that I had to keep my eye closed. And then the pain was so sharp in the right eye, it would go to my head. Head would heat up. Sharp migraine. I had no idea what the hell's going on. Going back to the eye doctor, gives me steroidal eye drops. Put those in, still won't go away. Then allergy season goes away. So it's like, wait, it's not allergies. It's November. What the hell? That doesn't make sense. The peak of allergy season in May and June. I thought it was that. It's not that. I'm not using screens. In fact, I just took a break from work for 4 days or even a week. Still won't go. What the hell, man? What's going on? I'm like banging my head against a wall. I had no idea what was going on at the time. And then a couple of years later, it kind of went away with. And I'm not sure if you have any experience with this, but this kind of related to mind, body, psychological stuff. But I had a very powerful psychedelic therapy session where certain traumas were relieved. And this pain in the right eye just kind of magically disappeared at one point. But later on, when I discovered the TMS community and mind-body issues, I looked back at my life, and that was one example where I was like, oh, wow, okay, that was probably very likely mind-body, and I wish I had known at that time instead of just getting ramped up with stronger and stronger eye drops or moving away from the screens and just being so stuck, right? So many people... Like I look back at that, I'm like, I wish I had known. I wish somebody had said, wish my doctor had said, hey man, this is not an eye problem. It's not your laptop screen. It's not allergies. This is mind body.
We skipped over the eyes. I mean, I actually have seen other patients with eye pain that turned out to be psychosomatic. And one of them had been to everybody, every ophthalmologist, every specialist. So it's really amazing how there's almost no part of the body that can't have this kind of a problem exist. It's absolutely incredible, and yet it's not taught in the vast majority of medical school settings. It's just so powerful and so amazing.
Yeah. So obviously, we're not going to list probably every single thing, but let's sort of roughly. So we talk about chest pain, abdominal. That brings up, I guess, digestive,
acid reflux. Gastritis, unexplained diarrhea, irritable bowel syndrome, constipation. It doesn't mean that in every case we can alleviate this completely with a mind-body approach, but we want to look. I've treated people with all of these conditions, and they've gotten better. So, we're working our way to pelvic. It can be female pelvic pain. It can be male pelvic pain. Even penile pain. We're talking, I've seen people with leg pain, arm pain. It's so many that it's like you can list everything in the body. Obviously, back pain, mid-back, low back,
Yep.
coccyx pain, which is the tailbone. There's people who fall on their tailbone and they're told you fractured it, that heals in 3 weeks, and that they have pain 3 months or 6 months later. And they come in and I tell them that your tailbone's healed. This is no longer a structural problem. This is a nervous system problem. This is a mind-body problem. The reason why you're not getting better is because doctors are focusing on your tailbone, not your nervous system, right? The brain is processing all sensations in the body. If Rob, you're sitting in a chair, I'm sitting in a chair. We have certain sensations we're feeling from the chair. But after a few seconds, our brain ignores the chair and focuses on talking to the podcast to each other. And then after a few minutes, you kind of get that desire. You want to, adjust your position, and then you get comfortable again, and your brain notices sensations and then ignores sensations. And it's really everything's being processed in the brain at all times. So people will say to me, are you saying this is in my head? And I'll say, well, only to the extent that your brain is in your head and that this is a nervous system or a brain problem, and it's fixable. It's not a brain damage problem. It's just a functional brain problem. And we cure it with education. We cure it with psychology. We cure it with journaling. And that's how we fix this.
Yep. I want to talk about treatment in a minute. I guess a couple areas I want to linger on, and because these can help explain, what this condition is. When we're talking about chest pain, to linger on there for a minute, chest pain, people have reported, this is something this is probably my biggest mind-body issue that I largely overcame. I recently tweeted about it. People were asking like, oh my God, wow, it sounds like you came from hell and back. So with chest pain, some people can report sort of left side intense, excruciating chest pain, and that can be a particularly scary, fearful area because that's heart. So people mistake. They sort of think in this reductionist model, I have pain in the chest, heart is there, therefore it's heart related pain.
Well, let me give you something for your listeners, at least those that are watching. I don't know how many people listen versus watch, but I ask people, where's your heart? And they often point here, right? So I'm pointing to my left chest here. And I tell them, no, that's not where your heart is. Your heart is actually center left. It's as if you put your right fist in the middle of your chest. And when you do that, the knuckles are bigger. So it's sort of center left, but that's where your heart is. Your heart is not over here.
Oh, really?
And that
didn't even know that.
I already fixed. Yeah, exactly. Yeah. I already fixed 50% of people with psychosomatic chest pain just by telling them,
wow,
oh, that's not your heart. And then I push on this area and I say, it might be the pec muscle, pectoralis, it might be the rib cage, but it's not your heart's not even there. It's not your heart, and that solves the problem right there. So it's a little bit of education.
Yeah. So heart. So we have. Excuse my ignorance here, but we have what's the structure here? This bone that goes in the middle.
Sternum.
Yeah. So sternum,
and the heart is behind the sternum. The reason why we have a sternum is to protect the core structures behind the sternum, which is primarily the heart.
Right.
The rib cage protects the lungs, but the heart is behind the sternum.
Okay. So, sorry. Point that out for me, and I'm going to describe it a little more for people listening. So the sternum.
Well, we can bring up an image, but I mean, the sternum starts at the jugular notch, which is right about here. It's a little kind of indentation at the top of your chest and the bottom of your throat. And then the sternum continues down to the xiphoid process here, which is a little bump in the upper abdomen.
Yep.
And this is your sternum, and your heart is right there. And it's center left. It's not left. It's not right. It's center left. And so that's important for people to understand their anatomy. We're trying to be educational here on the podcast, and the more we can teach you, the less you're worried about. And you go on, stay away from the internet, except for this podcast. You got to listen to this.
I will say, it's one of those moments. You've actually blown my mind there. In 60s, I actually had no idea. That sounds horribly stupid, but I feel like people like myself have researched a lot and still didn't even know that. That's probably many people have no idea about this, and you've just.
Well, I remember when the first weeks of medical school, I learned something that really helped me to understand how a doctor begins to become different than the layperson. So, like when I went to medical school, I had studied biology, biochemistry, chemistry, mathematics, all these pre-med courses, right? But I didn't know where my spleen was. Do you know where your spleen is?
No.
Okay, most people don't, right? But what I realized was if I'm in the first week of medical school and I don't know where my spleen is and I'm finally learning it, that probably means that most of the people I'm going to talk to as patients have no idea where their organs are because that's not what they do, right? That's not what they've studied. And so I realized I had to be very patient and that education was going to be an important part of being a doctor. Your spleen, by the way, is in your left upper abdomen, right behind your rib cage here. And the right side of your abdomen is where your liver is behind your rib cage, and your spleen is over here. So you hear about somebody having a ruptured spleen, it would be because of a very serious car accident or a very bad football injury where the upper abdomen was hit. But again, here's the thing. If people don't know where their heart is or their spleen is or their liver is, they can often create fear. They can say, oh, it must be my liver. People will come in and say, Doc, you sure this is not my kidneys? And I'll say to them, no, it's not your kidneys because that's not where your kidneys are. And
people fail the basic biology test, basic anatomy.
Well, it's not, we're not taught a lot of practical stuff. Everybody knows in the U.S. you learn a lot of stuff in high school that you never use, and some of the stuff you really need to use, like banking and finance and savings and retirement plans, you never learn that. You have to pick it up on your own, right? You're not taught it in school per se.
Okay, but before we get to the treatment, I'm going to get treatment and one more thing on diagnostics. I have to linger here for a second. That was so interesting with that chest pain example. Can you expand a little bit more? So you tell people this, and I'll relay my experience quickly. The left side chest pain, it's often more. It is sort of the dominant left side, kind of going to the edge of the left.
Point it with one finger. Point with one finger there.
Sure. I'll do that. Yeah. So really encompassing the whole area. So kind of to the left all the way.
Use the one finger though. So even if you have to move the finger, you can do that.
Oh, okay. Sure. Let me move this one.
It helps because otherwise you see a bunch of fingers. You don't know where to Okay. Yeah. So that's kind of where the pectoral muscle is and the chest wall. And so chest pain, look, there's a bunch of different structures, right? There's the skin, there's the subcutaneous fat, there's muscle, there's fascia, there's the rib cage, then inside deeper, there's the heart and the lungs. So there's lots of things that can cause discomfort in your chest. And people always go to the worst thing. But a lot of times it's just the muscles. Or you pull the ligament between the ribs. I didn't mention the ligaments that are between the ribs. It's just a skeletal thing. And immediately people go to, I'm having a heart attack or my heart's rupturing or whatever. And it's very often not that. Now, of course, in the emergency room, you see patients men in their 50s, 60s, 70s. Yeah, they could be having a heart attack. Women can have it as well in their 60s and 70s, most commonly. But most of the people we see in the office with chest discomfort, it is from muscles, tension, stress. It's a chest wall problem.
Yeah. And if you can close the loop here for people with psychosomatic left side chest pain, can you expand on how that presents? Like again, in my example, it was the left pectoral, that whole area, and actually moving to the left shoulder and exacerbated by it. And I want to get to more general stuff too in a sec, but it was more. I spoke to a particular expert in gastroenterology who helped explain this as well, that there's also, because my symptoms are related to digestive issues, that there's also, you're talking about other structures, there's also, I totally forget what it is, but some kind of digestive system issue that can come up, something can come up to left side of the chest.
That's like referred pain goes to the shoulder from the diaphragm or something like that.
Yeah.
That's less common, but that's certainly something that a doctor could think about.
Right. Yeah.
But again, it's part of the diagnostic process.
Yeah. So next thing would be, people can often get a diagnosis that's the deeper issue is mind body, but they've gotten a diagnosis from their physician that is kind of misleading and takes them away from where they really need to focus on, which is psychological. And I guess again here I'll use my example. So GERD, gastroesophageal reflux disease. That's a big scary. Oh my God, what does that mean? Gastroesophageal reflux disease. I got a disease. Oh my God. Right. Or people can get tendinitis is the other big one. I got tendinitis. Oh my God. It's an itis. That means something, it must be totally physical, biological. It's a disease state. Can you talk a bit about that?
Well, I could talk about before I even talk about those specifics, I think it shows you how the words that doctors use can be therapeutic or anti-therapeutic.
Yeah.
So there's something called a nocebo. A placebo is when things are done or said that lead to the healing response in your body or feeling better, right? Even though it's not an active treatment. A nocebo is when things are done or said that make you feel worse or get worse, even though it's not an active treatment. So when you're told gastroesophageal reflux disease and your brain hears disease, you're worrying more. You're feeling worse. What the doctor might say is you're having some acid that's coming up into your esophagus, and fortunately, there's some treatments we can use for that. And similarly with the other condition that you mentioned, the itis, tendinitis, you've got some irritation in your knee, and again, there's some treatments for it. Now, honing down on the treatments, if you're having gastroesophageal reflux disease, you're having acid, heartburn, it could be dietary. It could be structural, like a hiatal hernia, which is when the stomach kind of slides up a little bit in the above the diaphragm. It could be stress. Emotions can cause you to have more acid in the stomach and more irritation. So there's ways that a gastroenterologist or your primary care doctor can help you with GERD without it being a scary, frightening kind of thing. And there's obviously there's medications both over the counter and prescription that can be used. There's also dietary changes that may help, and there's also stress management that can help a lot. So that's important. I mentioned that I had knee tendinitis when I saw Dr. Sarno was diagnosed with TMS decades ago, and it's just a word. Itis can mean inflammation, and things can happen, right? You can get your knee can hurt. He actually preferred to call it tendinalgia, which means pain in the tendon rather than itis, because he didn't think there actually was inflammation. And the fact that I got better so quickly once I understood the mind-body principles indicate that it really wasn't that inflamed. It was more of an algia than an itis. And,
right. Yeah. So how do you? I guess two things there. I guess I'll relay my example again. So GERD, working with that, in my particular example, I made pretty radical dietary changes because it seemed like it was only coming up with, say, dairy or meat products. I went full on vegan actually because I thought it was like, things that are acidic like meat, dairy, they can harder to digest. Let's just focus on plants and easy to digest foods. But that didn't cure the pain, didn't cure the chronic chest pain and the acid indigestion, etc. So sometimes people can be misled. They can go down, radical dietary changes or other kind of changes, and it doesn't take away their issue. And then they're even more confused. They're like, what? I thought I had GERD. I just eliminated these sort of high acid foods. I'm eating food that I absolutely hate, but I'm doing it because I'm trying to fix, this problem, but it's not going away. So I'm curious your thoughts on that. And secondly, like, what I guess, curious for you to expand more on that with respect to people who get a diagnosis, but that diagnosis can be misleading. So like, I guess the question or the point to drive home, which I'd love for you to expand on, is you can get a diagnosis by your physician and it can seem physical, biological, or structural, like GERD, like tendinitis, but the problem may be psychological still.
No, absolutely. Everything you're saying is correct. Sometimes for a patient, it's a little bit of trial and error that you try one thing and try another thing, and you say, hey, these things aren't helping me, so I'm willing to look at other options, so to speak. I think it would be great to dig into the treatment a little bit so that your audience can hear a little bit more about how we actually treat these conditions.
Yeah, absolutely. But that is a common problem, right? People will get a diagnosis from their physician, right? And so they'll be stuck in thinking it's a physical problem. If there's a disease, it's, I've gastroesophageal.
Absolutely. Look, a lot of the people I'm treating with chronic pain, headaches, back pain, pelvic pain, etc., have unfortunately been misdiagnosed. And that misdiagnosis has led them down a certain path and led them to certain beliefs. And a lot of times I'm a deprogrammer. How they have deprogrammers for cult members. I'm almost like a deprogrammer from the medical field. is that people have been told by different conventional and alternative practitioners a variety of diagnoses that end up being false and counterproductive to their healing. So I have to kind of deprogram them from that, teach them what I think they have.
Exactly. Yeah. Yeah. Okay. Let's transition to the treatment now for the next 15, 20 minutes or so. So yeah, let's talk about treatment. So if someone learns, oh my God, this pain in my knee, this pain in my back, my digestive issues, bladder issues, whatever it may be, migraine, they realize, okay, it's mind, body. And I mean, I can't emphasize enough though, again, for a quick second, like that bridge can be so big from like accepting, right? You mentioned that as well. Like, like it's sort of, it's counterintuitive often. It challenges your conventional beliefs, and a lot of that's built by our current medical system. It just doesn't make sense. Like, wait, what? You're telling me my mind is that makes no sense. I got pain in my stomach, man. Or like, when I eat certain foods, I get the pain. Or when I make a certain motion, do a certain movement, I get pain. Why are you telling me this is my mind, right? Like that bridge can be so difficult to cross.
Absolutely. That's a very important bridge to cross. So if you have a physician who's versed in these methods, and my website does list other physicians in other states and countries, but if you have a physician that's versed in this diagnosis approach, then the ideal thing would be to see a physician and get that diagnosis and kind of get deprogrammed, so to speak, and on the right treatment path. If that is not available to you, then hopefully you have a conventional physician you trust who can at least exclude anything serious or dangerous to you. Okay, after that, either with the physician or without the physician, what do you do next? Well, again, I emphasize this little phrase. Sarno said, education is the penicillin for this disorder. So you start out by educating yourself. And fortunately, that doesn't mean an internet search. It means reading a book. And, my book is Think Away Your Pain.
Yep.
It goes into a great deal of depth about the diagnosis that you might have and how to treat it. And then Dr. Sarno, my mentor, wrote several books, and his books are available. Mine are also on Audible and Kindle, as are his. So that's kind of a great place to start.
That's a good point.
With reading a book. And then...
reading a book. You have a questionnaire on your website, you said. Well, I'm going to link to that.
I have a questionnaire on the website. The website also has other resources linked as well. It's got free videos, podcasts you can listen to, etc. But education, but it's in that ecosystem, right? It's in that safe, reassuring, informative ecosystem. The other thing that we do right off the bat, in addition to the reading or the other educational materials you'll find on my website, etc., is journaling. So some of you may know what that is and some may not, but journaling is expressive writing. It's sitting down for 10 or 15 minutes a day and writing about your feelings, writing about what makes you upset, what makes you worried, what makes you angry. And it turns out that writing about your feelings helps you to sort of process them and in a sense, get them out of your system in a good way, or get them, if they're bad, get them out of your system and release them. I've written a workbook called the Mind Body Workbook. There's 2 volumes. You can do the first or the second. The second is more recently done. And the Mind Body Workbook is your guided journaling. So it can be hard to you can get a $2 notebook at Staples, but it can be hard to figure out what to write after a few days. So the workbooks that I've written give you guidance and prompts that you can respond to so that you can spend those 10 or 15 minutes a day going through surveying different parts of your life and getting to some of the emotional stuff. So this is it's the cheapest and most effective form of self-psychology, right? You're not seeing a therapist right off the bat. You're doing journaling. So you start off with education and journaling. Another thing I like is affirmations. So affirmations are positive statements designed to reduce your fear and worry. So for example, if you're having back pain, it might be, my pain, I'm healthy and strong. My pain is going to go away completely. All right. So that's a simple affirmation. You may not totally 100% believe it the first day you start repeating it yourself, but it's extremely effective to start with that. There's a saying in psychology, fake it until you make it. There's an app that I also mentioned on my website that I like called Think Up, and you can download it for free for 7 days. I contributed 16 affirmations to the app, and the app just helps you to organize some positive affirmations in your life and to kind of repeat them to yourself or record them on the app if you so choose. So affirmations can be helpful.
I'll testify to that. in my particular case, again, getting into this world is so counterintuitive. Like you feel like, wait, this
Yeah.
none of this makes sense, but it does make sense eventually. The self affirmation, that's something I think I tried based on Howard Schubiner's workbook, and I assume there's going to be similarities there. Your workbook,
Yeah.
Howard's workbook, and in there he talked about self affirmations, and the one that I used was "I'm safe and healthy,"
Yeah.
and when you say it, and you're dealing with this condition, when you say it, you know, if you've been intellectually convinced that you have a mind body condition, which I did at that point, or largely did. Sometimes you begin to question everything as usual, but you're convinced intellectually. But surprisingly, like you can say that to yourself, I'm safe and healthy, and there's actually a bridge there because like you intellectually, okay, fine, mind body, but when you say that, there's something at like the emotional level which doesn't feel right. So it's like you repeat it, kind of internalize it over, like I am safe and healthy, and like man, like I really deep down inside, I haven't felt safe and healthy, even though intellectually I've convinced myself I am. There's no heart condition, there's no this or that. I don't have cancer, don't have diabetes, but something deep down inside the nervous system feels unsafe, and that relates to like polyvagal theory, nervous system safety. Oftentimes, people with panic, anxiety disorders, mind body. In this particular case, there's a lack of safety. There's a feeling of danger.
Yeah, absolutely. So affirmations are part of the treatment approach. They're not going to fix your whole psychological makeup, but they're a nice little thing to reduce the fear and change some of that negative chatter in your head to something more affirmative, more healing.
Yeah.
Another thing you can do, there's a movie you can stream called All the Rage. And it was a movie made by a director who was a patient of Dr. Sarno's. I make a cameo appearance in it, as do several of the physicians who've been mentioned tonight and who work in this field. All the Rage can be streamed on Amazon Prime and Vimeo, and it's just a few dollars. The director, I don't think he's still paid off the original cost of the movie, so it goes to that good cause. But again, it's something you could watch and just kind of get a little more knowledge and information about this field. So again, what I typically do, it's almost as if you're in my office today, because I would typically recommend a book for you and a journaling, and I'd recommend affirmations and a podcast to listen to like this one or one of the other ones that I've done, maybe a movie to watch. And, going forward from there, what do I do if people aren't responding or they need a little more help? Well, we have several things we do. We have an online group that I lead with a psychologist kind of once a week. We do 90-minute sessions. It's a 4-week program, so to speak, group sessions. We also have referrals to excellent psychotherapists. Many of them are listed on my website. And when you see me as a patient, then obviously I tailor your specific personality and needs to refer you to the right therapist. But there's excellent therapists in this field who can work with you, who are experts in this TMS mind-body approach. And there's even TMS coaches, both in the U.S. and abroad. And these coaches work internationally. A coach is not a psychologist, but they can give you a lot of guidance in terms of how to do this work. A few of the excellent ones are listed on my website as well. So there's a lot of help out there, right? There's a lot of help you can get. And there's other books that I would typically give people as like a follow-up book, when they've read the first one or two, maybe give them a third. You mentioned Alan Gordon's book is good. There's other books that I recommend. And a combination of like the reading, the journaling, and just your internal work to decide this fits me, this feels right, and I'm not going to need to suffer anymore. I can move on. I'm healthy and strong. I'm safe, and I can move on. And it's hard to believe that this is enough, but this combination of things over the course of weeks or sometimes a few months begins to transform the nervous system. It's called neuroplasticity. And it begins to change the pathways in the nervous system that have been reinforcing your problem. So that's what I find to be effective, of giving you an outline of my treatment approach. Obviously, I individualize it for each person. But
and when it comes to, I guess I can only speak for myself, but like longer term, and I assume this is common, rewiring the fear patterns can take time. And it's not just often merely a case of education or watching a movie or learning about it, but actually changing those fear patterns. And that's where Alan Gordon, in his book, The Way Out, talks about somatic tracking. I assume so. Do you leave that in your particular practice? You leave that for the therapist to work with, or
Well, look, I like the term somatic
okay,
observation more than tracking, but that's obviously the name he gave it. It's a technique. There's lots of techniques. I've been doing this work for a long time, a lot longer than actually anyone else practicing at this point. And since Dr. Sarno died some years ago,
longer than Howard as
and
well.
there's a lot of different.
Yeah. Okay. Interesting.
Oh yeah. Oh yeah. Yeah. I'm doing it longer than far longer than anyone else in the world right now, because I was Sarno's first kind of disciple, if you will. And when I learned from his early work, this is before he had written books, this is before there were internet, this is before there were podcasts, is that if you can change your attitude and belief, you can get better. And so that's what Sarno did. I mean, that's what he did decades ago with me, with a little seminar at nighttime and with a bunch of people in the room, is he changed my attitude of what was wrong. He changed my belief in what my diagnosis was, and with the office visit. And so you add on top of that these great resources that are available, books and techniques and all that stuff, which is great. And some of the psychologists enjoy some of the techniques you mentioned, like somatic observation, but there's lots of techniques that can be used psychologically, and you can't get stuck sometimes for too long on one, because there's people for whom they respond really well to that method. And there's other people who need to go a little deeper or learn more about where their anxiety is from or what their childhood was like, et cetera. So different techniques for different folks. And, something that works for you, obviously you have more belief in than something you're not as familiar with. But I know you've had some good experience with that book and that approach. So that's great. But there's lots of other approaches. There's lots of individual therapists that have developed some really neat stuff. And not all of them have written books about it. So that's where it is.
Correct me if I'm wrong. Ultimately, the idea is to, deal with that, or address that fear that you have. Because, I don't know if that's too reductionistic, but like fear is causing the pain, right? That's the standard way of talking about it.
I would say that fear fuels the pain. I wouldn't say that I say that fear is a significant factor, but, also anger can be. Also, anxiety can be. There's lots of emotions that can contribute to the pain, and so it's not. We don't oversimplify it. I mean, almost all the patients that come to me with chronic pain are afraid it's going to be permanent. They're afraid it's going to be. There's no cure. I mean, that is a very common fear. On the other hand, I try to address those fears, but I wouldn't say that that's the be all and end all of it for many people.
Yep.
It varies. It varies. I know you've had certain experiences that felt strongly effective for you, and I'm not trying to in any way say that your experiences are not valid, but I'm just saying that I've treated over 4,000 patients with this approach in the last 27 years, and there's different ways to skin a cat, they say. And
I guess
to this.
Alan Gordon, his book, The Way Out, he pinpoints fear, anxiety, and related emotions, but fear and anxiety as being the kind of culprits for.
Yeah. And that's good as far as it goes. In Dr. Sarno's book, Healing Back Pain, he talks more about anger as an underlying emotion. I don't believe that it's one thing only for everybody. There's these psychologists who've been working in the anger model for many years. You've got the people trained by Gordon who work off of the fear safety model. Great. There's other people who work in more of a internal family systems model. And there's lots of models to uncover why somebody is stuck. Now, there's some people who never need to see a therapist at all. They just need to learn about this diagnosis. They need to think a little bit differently and move on with their life. And certainly they're going to feel less afraid once they feel like they have an approach that's working for them and an approach that makes sense to them. But I think that there's a lot of different elements to this.
But would you agree that for people, for education is not enough, and it's a very chronic issue lasting months or years, these deep patterns of anxiety and fear, like, oh my God, it might be disabling, it'll be last forever, it's going to ruin my life, whatever, that, speaking, I guess, generally, if you don't address that fear, that sort of internal fear or anxiety or worry, the catastrophizing towards that pain or towards life in general, that you're not going to see positive results. Like you have to rewire your relationship to the pain, rewire your relationship to fear, so that, when you get fear, whether it's that pain in particular or a different pain that might come up, rather than, oh my God, oh, what's going on here? Oh my God, my life's through, like that pattern. You have to really change that pattern, and it might be anger in other people's case.
I agree with you. I agree with
so
you.
I guess I've, somatic tracking and affirmations, that seems to have worked a lot, but it sounds like, somatic tracking, that's a term that we're using, but really how I've taken it generally is like, that's, feeling the sensations and, separating your fear from the sensation, essentially speaking, very broadly speaking. But from what you're saying, there can be other things too, other than that, when it comes to just directly addressing fear patterns and patterns of anxiety.
Yes, there can be. I mean, I don't want to get too deep into the weeds, so to speak, because many of your audience has never heard about this before, and now we're kind of getting into the fine points of the psychology and stuff, and it can be a little bit overwhelming for people. I think it's important to learn that there is this diagnosis, to learn how we diagnose it, to understand, some of the risk factors, personality characteristics, to understand the treatment models and methods and some of the psychological aspects of that. But I think you can go a little too deep into the weeds sometimes, and that can get confusing or distracting for people. So, I used different approaches, and Alan worked in my office when he was starting to develop some of these methods, and I really liked him as a therapist and stuff. Now he's gotten more into public speaking and writing and stuff, so that's cool. But he's a really good therapist, and unfortunately, he's not really seeing that many patients anymore. But he's trained a lot of people. It's just that obviously they don't have the experience he does, and they're not him. But the good news is there's lots of therapists, and once they've if they've started working in this area and they start expanding what they know and how they approach it, it's great. And people, I learned from Sarno that you give patients a little bit of room to kind of figure this out. You want to structure them, but you don't want to overstructure them, because patients have the ability to heal. And what they need is kind of a push or a nudge in the right direction with new information, new guidance, etc. And you'll find one way to heal that'll be different than the way someone else finds a way to heal, or another person. Everyone has unique background, strengths, and abilities. So it's not just one, cookie cutter approach for everybody.
Right. Yeah, that makes sense. And for people listening, we'll definitely have on people more in the psychotherapeutic arena that are more we'll get more into the specific psychological techniques to deal with this. Alan Gordon referred me to John Gesianenka. Probably mispronounced his last name, but I don't know if you're familiar with him. But he's a psychotherapist that's worked in this area. So for people listening, we'll get deeper into the psychological stuff as well. But lastly, before we go, Dr. Schechter, I'm just like astonished and amazed and just reflecting on like the fact that this is not readily available, and this current model that we're in, where like, certainly my experience with my primary care physician and many, many other people that I know, that their physicians just have no idea about what we're talking about here in this podcast. Like, this podcast could be more informative and educational and healing for people than going to visit their family doctor. Like, I'm just amazed here, just thinking about the magnitude of this, that we have, potentially tens of thousands, millions of patients going to the doctor, and they're just not getting the right information. They're being pushed on pills, medications, thinking that they have some disease. And sometimes the diagnostic can be true or accurate, or it can be totally wrong. But in either case, it cannot get to the heart of the issue, which is psychological. And I'm just like thinking about this, like the scale of this, like it's just so tragic is the word I'm thinking of here. Like really, truly tragic. People spending their whole lives with these pain syndromes, and their doctor not able to really help them because they just haven't gotten the right information. Right. I assume you're sharing that sentiment. And I'm not exaggerating by any means.
Yeah, no, it really is tragic. I mean, there have been studies that have suggested that up to 60% of the patients going to a primary care physician, the underlying diagnosis is more psychological than it is physical, whether they're coming in with one thing or another. It may be more about stress and all of that, depression, anxiety. and obviously TMS and chronic pain. But we need to get this. We need to get this word out to more people. I've developed a program for high school students. It's a pro bono program. If you have any teachers out there that are interested in this, let me know. You can contact me through the website. I'd love to get this. I'd love to get this work to younger people so that they know about it in their teenage years, so that they don't get these conditions in their 20s, 30s, and 40s. Right?
Oh,
I mean,
man.
wouldn't that be
That would have
great?
been awesome if I'd gotten that.
I have a
Would have
program.
loved to have gotten that when I was 17. Would have been awesome.
Yeah, absolutely. I wish I had gotten it. I wish I had gotten it too. So yes, we need to train doctors. We need to train. We need to educate the lay public, and we need to train, the healthcare system, which is so geared toward surgery and very lucrative procedural-oriented specialties and techniques, and doesn't focus enough on sitting and talking to somebody, getting to know them a little bit, getting to understand their psyche, and that's really where so much of human health and disease
and
resides.
That's how you see the way out when we're talking broader on a societal level or an institutional level. When it comes to training doctors, like, do you think there needs to be some serious reforms in the way doctors are educated?
Yes, absolutely. Serious reforms.
Yeah.
Absolutely.
Great. Well, Dr. Schechter, thanks for coming on. I greatly appreciate it. This is the first podcast I'm doing now on mind-body issues. I'm going to be doing a number of them, inviting different people on, talk to Howard Schubiner as well at some point. So I hope this is just a series of education for people who just have been struggling for a while. I'm almost certain, given the statistics, that there's going to be some number of people for whom this is going to be very healing and relevant towards, or at the least they might even know someone. I had someone who I was telling, my story to and what I've dealt with, and this person's mom had been dealing with this for a while, and then I talked to her about it, and she's like, "Oh my God, wow, really? Like, are you sure? Like, this could be mind body?" I'm like, "Yeah, it could be." So, this problem is very common, and people are struggling with it for a long time, whether directly or they might know someone, or they've heard about it. So, I hope through education and resources, people can get to work and actually address these complex problems that the conventional medical system just is utterly failing in addressing.
Yeah, look, I appreciate you inviting me on your first Mind Body treatment podcast, and I continue getting the word out there to people, because there's a lot of people need.
And
to
ways for people to find you and get your resources. Do you want to mention social media, your website?
Yeah, we've got the mindbodymedicine.com website is probably the best way. We've also got Twitter, pain_MD_LA. We've got Facebook.com/thinkawayyourpain. And a little bit of Instagram too, but I'm not going to mention that one right now. I can't think of what the handle is. So the other one, the website has all the links to the social media as well.
That your personal website?
Mindbodymedicine.com is my website for mind-body disorders. I also have a website, schechtermd.com, for general issues in the office and that type of thing. But if you start at mindbodymedicine.com, that'll usually get you where you want to go for these kinds of conditions. And it also has links to my books and my online course and videos and other things, some of which are free,
sure,
and some of which you have to pay
and
for.
For people wanting to go deeper or interested in the therapeutic side, there's a couple of places that I've looked at. Pain Psychology Center in LA, I believe. You can do virtual visits with them. There's another place in Portland, Oregon. The name's escaping from me, but there's clinics out there too with therapists fully trained in mind-body issues, and you can see them virtually and try, just go straight into the therapy, and you can start working and talking and figuring out what's going on as well. Anything else you want to say before we sign off?
No, I think that's it. Nice to be on your show.
Thanks everyone for listening, and hope this can help you and any other people in your life who are struggling with a particular pain issue or something might be psychosomatic. Feel free to share this. And like I said, I'm going to be doing much more of these in the future, because I think this is a totally neglected side of medicine, side of psychology that people are not paying enough attention to. So look forward to more content on this. All right. Thank you, Dr. Schechter.
You're welcome.
Has the dust settled from the COVID policy response? Far from it. The storms are many: inflation, learning losses, ill health, high crime, broken government services, displaced workers, substance abuse, mass loneliness, discredited science, real estate crisis, censorship, and overweening state power. The world is on fire with war, mass killings, crime, hunger, revolution. The lack of accountability, or even so much as an apology, is a foreshadowing. They'll keep their newfound powers and try it all again. Brownstone Institute is seeking answers, undertaking important research and publishing the results while providing fellowships for dissident scholars who have been professionally displaced. It's not about this one crisis. We urgently need to restore peace, prosperity, and integrity in science and journalism. Visit brownstone.org for more. We may never get to the truth, but we can get closer to the truth. There will be no stopping the efforts.